Tenant Community Association, and we thank the Most High for blessing us with the opportunity to be with you and you to be with us. In the program, The Communicators does not reflect the views, attitudes, whims, deeds, or any other proclivities of the management of the Tenant Association, nor that of the administration of this housing development, the Grand Houses in Harlem, USA. However, the program does reflect the research done by the participants in the program live in living color in studio and by phone interview. And ladies and gentlemen, very soon you'll be able to interact with us by way of computer, Instagram, Telegram, Wordgram, etc. But that's coming soon. However, we have with us one of our favorite interviewees, and that is Dr. Belva Bowles by way of Louisiana and North Carolina. Thank you for joining us, Dr. Bowles.
Always enjoy joining you. Good afternoon, everyone.
And we're going to, first of all, for the audience, the primary topic this afternoon is how to prepare your child to be an A student. But before that, we're going into some medical areas that a lot of people need to know about. And we're dealing with husbands and wives and the fact that there are mammograms and thermograms, etc. So we need an understanding on when a doctor chooses to, when they see or they say they see indicators of something and they recommend a mammogram, and when do they recommend a thermogram, and what are the two?
Well, the first thing I would talk to the parent, consider the age of your child.
Wait a minute,
we're talking about.
We're not talking about we're talking about the mammograms and the thermograms.
Oh, you okay? We'll do mammograms. Okay.
All right, and the question is for husbands and wives, when is it a recommendation on the part of a doctor to have the woman go through a mammogram, and when does it occur for the doctor to recommend a thermogram?
Okay, all right, I missed the question. Yes, mammograms for the black population are not very reliable. That's how we should start. Second piece of information is men and women can get mammograms and should if they find a lump or a suspicious tenderness or any kind of changes in the breast tissue. If there's fluid that comes out of the nipple and you're not a lactating mother, there's something wrong. So a lump is not the only thing that should indicate a need for a mammogram. The American Medical Association recommends that a 40-year-old woman should have her first mammogram, and that would be what we call our baseline information. And this recommendation is anyone who is otherwise healthy, has no history of breast cancer in the family, and just wants to get a checkup that's more inclusive. But again, if you feel a lump, a tenderness, asymmetry, if you were have part of the breast shrinking or show some kind of abnormal changes, any secretions coming out of the nipple, those are all indicators that you need to investigate further. Now, when should you do a mammogram or a thermogram in black women who have double D cup or higher? The instrumentation was not designed for you. Therefore, if you go in and you have heavy and what they call heavy, dense breasts, the mammogram has a very low efficiency. I think it's something like 60 to 70%. What does that mean? You can dose the agony, and those who've had a mammogram, of having your breast placed between those plates, and they apply pressure, and then they scan. If you have dense breast, you can actually have a nodule or lump, as they called it, and it will not be picked up. So heavy-breasted women, the number one way to identify any possible lumps or bumps, believe it or not, is a manual exam. I made a point of always teaching young women and women in my practice how to do a self-exam, and I don't mean to be risque, but a high percentage of breast lumps are identified by the partner of the woman. So if you like a good breast massage, and that's part of your otherwise recreational activity, let it also be something that can save your life. There is a very specific way to examine the breast, and it can be easily taught. So if that's a community service that someone wants to perform in your area, or if you have a nursing student or nurses or doctors who want to show someone how to teach others, it is worth it. And men and women get breast cancer. It's not exclusively women.
Okay, so the exam is done and something is seen, or something appears. You know, what does appear, if anything at all?
Well, if I'm doing a breast exam, I'll just talk you through it. I tell everyone to imagine, if you've ever taken the skin off of an orange and you look right on top of it, you'll see it's a center hole, and then each slice of the orange is kind of compartmentalized. Well, if you imagine that on the breast, where the nipple is like the top of the orange, and the breast literally goes off in quadrants, just like the slices of the orange. So if you're going to examine it, you have to examine each one of those slices, if you like. So the way in which I teach the breast exam, if you're doing a self-exam, you start on the right. The thumb should be on top of the breast, and the other four fingers should be underneath the breast. And the reason you do that, it allows you to, in most cases, unless you're real spritey and have nice high breasts, most of black women have what we call pendulous breasts. That means your breasts hang down. And the only way you can get a full exam is to cup the breast. So your thumb's on top, the fingers are below, and then I slowly rotate the hand so that my four fingers are actually cupping the breast tissue, and I slowly raise my arm in a clockwise position until I have come to the top of the breast. All four fingers and my thumbs at the top, then I repeat on the other side. You want to always massage each orange slice, if you want to think about it, because a lump can be hidden in those sections, and if you just kind of grab the breast and fill it in general, you can actually miss a small lump. And once the lump is big enough that it's easily palpable, it unfortunately may have also metastasized, which means that cancer could have moved into other parts of your body.
I want you to go over that again. Doc, I want you to go over that piece again.
Okay. A breast exam is very important, and what I failed to say is when and where. In the shower, I teach young women, and usually I start in adolescent years, that they should do a self-exam. I believe everyone should know their own body. So if you take the idea, okay, when I'm doing my shower or my hygiene, I'm going to also check my breast. You place your hand, you cup the breast in the palm of your hand, quite frankly. That's a better way to say it. And move very slowly as your elbow is raising, and what you're doing is taking your fingertips and sort of massaging and feeling the tissue. And then once you come all the way out to the top where the thumb was, cup the other way and do the same thing again. And like I said, it can be an adventure and a little bit of a fun if you have a partner who wants to be doing the exam. And like I said, a high percentage, more than 60% of small lumps reported, or when they come to the ER or they go to a private physician, is because the partner found the lump. So that might be what you want to add to your repertoire if you have a partner you trust. And it should be done, I say, 2 or 3 times a week. It's not a once a month, once a year. And if you are under the age of 25 and you're female, there is something called polycystic breast. And what that says is you're in the high reproductive age, and during the menstrual cycle, the breast actually enlarges. And some women suffer with painful or tender breasts at that time. And if you do an exam, you may find small lumps. Those are not cancerous, and we call it cysts. because they usually get reabsorbed as the cycle goes on. But if you do a regular exam, you'll come to know the difference. You'll say, okay, when I was 17 or 15, I used to have this lump. Well, when you're 30 and you have that lump, if you haven't been a regular examiner, you don't know if that's something to worry about or something you know familiarly. So I say know your body.
Okay. All right. So what happens, self-exam, and they find something, and what happens?
Self-exam is the best and number one diagnostic tool. That's the number one. Number two, if you don't have the heavy breast, mammograms can be very helpful because it shows anything that's abnormal from breast tissue. Now, brother, I'm going to take a moment to tell you there are 8 types of tissue in the breast. Therefore, there are 8 types of cancers that can arise. Unfortunately, a lot of times on TV or radio or lay people, they lump things together. They say things like breast cancer, and then they talk about the genetic cause of breast cancer. Well, the important thing to mention is when I'm looking at a radiograph or a mammogram reading, I'm looking at all the different structures in the breast, because you can have a sarcoma, carcinoma, adenoma, comacose, all different types of cancer that reflect the types of cells that are in the breast. So unfortunately, when you just look at Facebook or catch it on the news, one of my biggest challenges when I was still doing internal medicine is when my patient would start telling me, oh, my sister had a lump and her doctor took the lump out, or her doctor used a needle and then it went away. The danger there is the person makes up their mind what treatment they are going to have without knowing what type of cancer they have growing. And that's why I don't like using the word cancer. I'd rather tell the person you have an adenoma or you have a stroma, because then they know the specific type. So when you go in, and I caution all of my black sisters, instead of being very assertive, I've had some say, I'm not having my breast removed. I just want the lump out. But if their type of cancer is stroma, there is no specific lump. That kind of cancer grows along those parameters. I tell you that there's pointers in the breast that look like an orange slice, while stromas will go around each one of those slices, and there's no way to take out a lump. If you don't remove the breast entirely, you will have metastasized cancer in the liver, the brain, the kidneys, and that's essentially a death warrant. So when you go in and get medical assistance, go open-minded. And you can't use what your sister said, what your cousin said, what your auntie said, because unless they know what type of cancer they have, and you have the same one, you're talking, apples and oranges. And I've seen a lot of people make bad decisions based on street information.
Mm-hmm.
So they'll ask you, do you want to take radiation? Do you want to take chemotherapy? Sometimes it's surgery. So, yeah, we have different processes because there are different cancers within the breast tissue. So it's not like you're going to a buffet and say, no, I don't want this, I want that. You really want to ask whomever you trust in the medical field, what is best for my type of cancer?
Okay. Are there any questions we're not asking you that are normally asked?
Or you're asking me or your panel?
No, I'm asking. Well, we have a panel here, but they're not asking.
Yes. Okay, well, what frightens me is when I have a patient says, I let my doctor knows best. That, to me, is a red flag. That's someone who may have an expectation, therefore they can be disappointed. Let me tell you what that means. You come in because you had a tender spot. Maybe you had a secretion out the nipple. Maybe somebody found a lump. And you go in and you get the mammogram. And you're waiting to hear. And 1 week passed, nothing. 2 weeks passed, nothing. 3 weeks passed, nothing. And you're just sitting and holding tight because you believe your doctor will call you if there's something to tell you. I advise all my patients that You stay on top of this. Don't wait for the next appointments when you go in. Don't wait for someone saying, well, we'll get back to you. After you've had your test, wait 3 to 5 days and then start to hound the people. I can tell you, brother, when I was working in free clinic, one of my most painful things is to have a patient come in, I do an exam and identify they have some kind of advanced cancer. And I would say, have you never had, about 2 years ago, I did X, Y, or Z. And I'm looking at the end, well, the doctor never called me, or I missed the appointment that they set for me. And they waited 2 years. And I'm flabbergasted. Why would you wait 2 years not knowing an answer? You did that much work to get it inspected. Why would you think not hearing the answer is a good thing? So my biggest caution or cry out or shout out is once you go and have a test done, whatever it is, don't wait and just sit back and say they didn't call me. It's your body. It's your health. And when you call and they say, oh, we're going to get in touch with you, give them a day and call them back, or give them 2 days. Do not allow somebody who says, oh, we misplaced your file, or we put it on the doctor's desk and he was going on vacation. Any of those things can happen, but it's your responsibility. And that's what I keep saying repeatedly. Your body is your body. It is your responsibility to follow up. So when you say, are there any questions people aren't asking, my comment to you is they simply wait. I mean, it's kind of like when you tell an animal, sit, stay, and you walk away. How long is that animal supposed to sit, stay, and you not come back to it? We are all human beings. You should value your health. You should value your well-being. No one is better than you. The doctor is not God. So you need to know as quickly as possible what the results are. And the reason you want to know as quickly as possible is you may want a second or even a third opinion. So if you sit around waiting for one doctor to tell you and you let years lapse, then you're giving up your ability to get the best treatment. Because by the time someone does talk to you, you may have lost that window when you had more choices. So really, they should always insist on knowing what the results are. And if you have a position that says, let's just watch it. I've heard a lot of, unfortunately, people without insurance, or many times if the doctor knows that this particular process of treatment is expensive, they'll tell the person, let's just watch. That can be translated in, when this gets worse, we'll take care of it. I don't think that's an okay option. So you want to be sure that you first trust the person you're getting help from. If you feel suspicious, uncomfortable, then that's not the best person to give you health care. If you're intimidated or they in any way treat you that you feel less than, you're not getting the best care. I can tell you that straight up. If I walk in the room and I look at you or don't look at you, or the whole time you're talking I'm writing, or when I'm done I say, well, other than that, anything else, and you haven't finished what you had to say, that means that appointment was not effective. And I think we need to empower the patients, particularly our elderly patients, that that's not okay. That your care is just as important as anyone else's, and how you get treated, how you've been made to feel. If you go to what they call a free clinic, or some kind of, what we say, community service kind of evaluation, and your treatment is less than optimal, report it. Maybe you can't make the doctor be a better person at that visit, but you can certainly request another evaluation or make sure administration knows what's going on. That's so important.
Okay,
I had people tell me, I went to the doctor, but I ran out of time. I was like, you ran out of time? I don't know how you get to the doctor if you ran out of time, but that was what they were conditioned, that when the doctor was through listening, he got up, walked to the door and said, anything else?
So he goes on record.
So we need to know what is...
He goes on record, he or she goes on record as having asked you, is there anything else?
They walk out, they're hand on the door, anything else? Which means I'm through with whatever you're talking about. I literally have had some elderly black patients come to me And they'll say, well, I'm not taking this medicine, I'm not. And I said, well, when you went to the doctor last time, did you tell them? He said, no, they didn't ask. So consequently, what happens is they have a toxic cocktail. If they have 3 and 4 blood pressure medicines, one might have made them dizzy, so they stopped taking it. When they went to the clinic next time, no one reviewed their medicine. They just gave them a different one. They'll say, oh, your pressure's still high, and they give you another medicine as if they are doing an additive. My mother was a victim of that, and my mom would not talk about her medications with me, and I literally had to go in and find her medicines and write them down to know what she was taking. And once when she had a episode, I don't know the extent, my youngest sister took her to an ER, and the ER doctor called her physician, and every medicine he had ever prescribed was what he told them she was on. So these young doctors administered her prescribed medicine, and it dropped her pressure so low that she lost one of her kidneys. So when a patient decides that medicine is not what they want to take, but they are afraid to tell the doctor, or whatever the reason, they can end up in a situation where it becomes a life or death. Just stopping your medicine should never be an option. You should be able to talk to the doctor and say, I can't take this, it makes me itch, or I can't take this because it makes me cough, or I can't take this because I'm up all night running to the bathroom. Whatever the issue, the doctor's responsibility is to modify the medication to fit your lifestyle.
In terms of...
So what should the patient ask? Ask everything. When will my results be back? What can I expect to hear from you? Do I need to see a specialist once you get the results? So there's lots of information you need to get. And I advise, if you are nervous or unsure to talk to doctors, take somebody with you. You have a right to have an advocate with you.
We have a question.
Hi. Good afternoon, Dr. Bowles.
Good afternoon.
This is Esther Hyatt, and thank you for the invitation to your health lecture yesterday. I was sharing.
It was wonderful. I wish you were there.
I think I responded that I wish I was at the lecture, but anyway.
Yes.
I'm sure I'd really like to hear more about it, but time for me is sort of the essence. But I was talking to a young lady. I'd like to call her the friend of the wisdom table. And and she this past week she had an issue with her blood pressure. The blood pressure soared. The top number and the bottom number.
Yes.
And she spoke to me that evening. Seemingly, she was in the hospital all day with her mother, and her mother's assistant took the daughter's blood pressure, and it was very high. So she told me how high it was, and I said, well, what happened to you that day? Why is this unusual? And she said, well, I didn't take my blood pressure medicine. That's number one. She's in the hospital all day with her mom, and she didn't have it with her. Secondly, she said that she was so hungry that she just ate some, I can never think of the name, but it was cheese doodles or oodles. And I remember you sharing with us that this was fake food. So
Yeah.
I said, is that all you had? And she said, yeah, that's all I had. I just had to satisfy my hunger. I didn't want to go out and get any food and so forth and so on. Well, I knew that wasn't good. But to make a long story short, she went to the doctor that evening. And she went to the hospital. And when you said people who are without insurance, I'm concerned about intelligent people who go to the hospital emergency and they don't spend their money to get a private doctor, someone they could call and answer some of their questions. They just use the emergency room as their doctor. And I believe this is a young lady who can afford to have a private physician. But anyway, that's just my bias.
Well, you hit several points is so important, but go ahead, finish your comment.
So what happened was she stayed in the hospital for about 3 days, and she got regulated, I guess. Her numbers were a little better, and they sent her home. And while she was at home, she called me and told me what her numbers were, and they were better than the original one, because the first one she told me, I knew that was in the arena of stroke. And I'm not a physician. I'm not a physician. But what happened was last night she called and, yesterday she said that she was now going to try to keep her pressure down, and she was going to chop up some garlic, chew it up, and swallow it. So all I could say to her was, I think that's better than those oodles, cheese oodles. I forgot what you said happens when those oodles or cheese noodles get into your body. It might just...
Well, it could have even triggered some responses that made her pressure go up, because like you said correctly, it's non-food. What I would like to address, if there's time, there's 3 things I heard you bring up that I think is so critical to mention.
Okay.
One is for people who utilize the emergency room as their care because they don't have health insurance, they don't have a private physician, or whatever the circumstances. I'm going to preface this by saying for 18 years, I was an ER doctor in a rural place here in Louisiana. In fact, it was Breaux Bridge, if somebody said Foyer. And what I found is exactly what you described, that for whatever their reasons, and they were all legitimate reasons, and most of them were associated with money or income or lack thereof, they came to the ER. The law requires, and everyone should know this, that the emergency room has one charter, and that is stabilize a patient. Now, why do I say that? If you are coming in with blood pressure, that is not an emergency unless you are near stroke or a heart attack. That high blood pressure is considered a continuous condition here in America. United States does not go for the cure. I repeat, I want you to hear me clearly. Medication in the United States does not go for the cure. They treat symptoms, they change medicine, and it is an income property to own a pharmaceutical company. They are not there for the cure. Consequently, if you come to an emergency room, you're going to get spot treatment, and that's because we are stabilizing. So if you come in, you're neurostroke, I'll put in an IV, I'll probably give you some hydroxyline if you're a black person, I may give you some nitroglycerin, I may give you whatever you need, lidocaine if it looks like a heart attack. Once you are stable and your pressure is not at risk for a stroke or a heart attack, guess what? You get to go home. Now, does that mean that tomorrow you may not have the same symptom? No. Tomorrow you may experience exactly the same thing. So people who utilize the emergency room as their only care, they are playing Russian roulette. Because in most cases, ERs can only write a 10-day prescription. So although I may be looking at someone who almost had a stroke that I stabilized, it took me, 4 to 6 hours to get you back into a normalized state. When you're ready to be discharged, if I haven't seen reason to you be in the hospital, all I can give you is a prescription for 10 days of medicine. What happens on day 11? Day 11, you can go through all of that again, because if you show up at my ER, I'm not going to look through a book and say, oh, you were here 10 days ago, therefore let me do this and this. You come in as a new patient, and that condition is treated all over again, and if you get a doctor that's not me, they may choose a whole nother course of treatment, and then you get discharged. So ER does not provide continuity of care. It was never designed to provide continuity of care. And patients who come in with what we call non-acute conditions get treated very badly. People come in with high sugar levels, risking blindness and risking heart attack, will only be stabilized. And I repeat that. They are not treated for the cure. They are not treated for the long haul. They are only stabilized. That is the charter of an ER setting. So whoever goes to an ER for whatever condition, if that condition is non-acute, and what is acute? You're hit by a car, you're hit by lightning, you cut your finger, you hit your head. Those are emergency situations. If you come in and you have diabetes and you tell me, well, my foot is all swollen up, and I look at it and I know by one sight that foot is highly infected, you may need an amputation, you haven't been taking care of your sugar, I'm going to give you IV antibiotic, and I'll probably admit you to the hospital. But I am not treating you for a cure. So that should just be yelled from the rooftops. I ache to see my people doing a revolving door, coming into the ER, getting a 10-day supply, and going back out. There has to be an alternative. In New Orleans, they started a walk-in clinic attached to the ER and doing triage. Sometimes the person who was talking to whoever was in the waiting room, they would tell the patient, no, you don't need to come to the ER. You need to go to the walk-in clinic, because all clinics are required to keep a medical chart. The medical chart is a continuation of care. If you came to me last week and your blood pressure was this high, I also know what blood pressure medicines you're taking, and I can say, stop taking this and start taking that. But that's continuation of care. That is not an ER visit. And I don't think that the people who utilize the ER really know that.
Right.
I mean, I can see somebody and know them by name, know them on site, but the treatment is suboptimal because you're asking for an acute care situation when your problem is considered chronic.
Yeah, well.
So if you say black people get substandard of care, they don't only get substandard in the ER, they get abbreviated. It's not continuous, and it's I can't emphasize that enough. That is such a mistake to utilize the emergency room for your care.
Yeah. Well, you've hit it on the top of the nail when it comes to her.
Well, I mean, we are the number one population with strokes, kidney failure, and amputations because chronic diseases, which include high blood pressure and diabetes, are not treated on a continuous basis.
Right.
We treat it when we're at death's door. And if you're at death's door, you're going to have that stroke. You're going to have that heart attack. You're going to lose your kidneys.
One thing I wanted to add, I told her she should get a book, a notebook, and write down what she ate that night or that afternoon, and what was her blood pressure. I said, you have to go in and be able to tell the doctor, whomever the person is, what has happened to your body over a 24-hour period. What you ate.
You have me smiling because in the rural parts of Louisiana and the places I opened clinics, I would have what I call a surge after the 4th of July. I'd have a surge after Thanksgiving. I'd have a surge after Christmas. Mm-hmm. In the 4th of July, the whole world eats hot dogs, and a lot of people eat salty pickles. Here in Louisiana, it's all part of the celebration. And those who know that, they're on diuretics. When you eat in high salt, you retain water. So if you eat that big, juicy, salty pickle on Saturday, Sunday morning, you're going to be in the ER in congested failure. If you eat that big cheese-laden pizza slice when you went to the fair because you took your grandkids, I'm going to see you, mid-morning, somebody's going to come with an ambulance because you're going to have congested failure. So you are right exactly right, that the foods you eat are a direct correlation with how you feel. And the unfortunate thing is, in America, we're fast food, junk food eaters.
I know.
Doc, when you were talking about
Yes.
the little book, I remember I went to the doctor and they gave me a book to monitor my blood sugar, and they told me to take my blood sugar, after fasting and everything. And I was actually using that thing. I was sticking myself and taking my blood sugar after I ate everything, maybe like 5 times a day, so I could figure out what it is was keeping my sugar up so that I could start eliminating stuff. So I did that, and I eventually got my sugar all the way down to normal levels by eliminating all of the crap. And people could tell you about crap, but when that lady gave me that book and I started taking my blood sugar like five times a day, particularly after I ate something, I figured out what it is that I didn't have any business eating anymore. And eventually I was able to get my sugar back down to normal after one of my friends who was a doctor explained to me how the pancreas, or whatever that thing is that commits your insulin, how it worked. And I think that you're absolutely right, that if someone wanted to really monitor their sugar, they would take their blood sugar many times that they could stick themselves after they eat, and then they would see which foods was driving, this is what I did, which foods was driving the numbers up and which foods I shouldn't eat, and I started just eliminating them because the doctor scared the shit out of me.
Well, Sarah, you bring up another very important point. In the communities where they have insurance and or I don't want to just make it a black-white issue, but it is a financial issue. In my clinics in New Orleans where I had clientele on Blue Cross Blue Shield, anybody with a diagnosis of diabetes would be sent to a nutrition clinic. And in that nutrition clinic, the person did exactly what you're talking about, but you didn't have to stick yourself 5 times a day to get your sugar numbers. They'd sit down and talk about what foods are you usually eating, what time do you usually eat, because we had some problems with patients who worked 16-hour shifts or 12-hour shifts or overnight, and sometimes how your body metabolizes food can be dependent on what time of day you eat.
Correct.
So they would actually have a nutritionist who would do the hard work that you seem to have done for yourself, and before you leave that counseling, you would know what foods to avoid, you would know what time to eat, you would know what quantities.
Right.
And in these upscale, more rich clinics, these patients maintain their glucose very well, sometimes not even requiring insulin,
right,
because they get the one-on-one and the support, right, which is necessary. I come back to the lower income and unfortunately a large population of black, particularly in rural areas. They do not get such counseling. Their food is not monitored. And then the bottom line is, what can they afford? So if you go to these single community meetings where they're supposed to educate the poor people on what to eat when they have diabetes, they talk about foods we don't eat.
Correct.
I mean, I went to one of them, they're busy recommending eat more kale and eat an apple, and I had to stand up and say, the number one food in this community is beans and rice and cornbread and ramen noodles. So I need someone in the front to talk to me about beans and rice, cornbread, and ramen noodles. And I did it because I knew the constituents weren't brave enough. Why do I want to hear about cauliflower and kale, and I don't eat any of that?
Hey, Doc.
And they were paying people to come into the community, and this was supposed to be a community awareness, nutritional training, and nothing they were talking about was relevant to this community.
So, Doc, when they sent me, it's funny you said that, they did send me to a nutritionist, but the reason why I did what I did is because I didn't believe nothing she was saying, like probably most of those people sitting in that audience. And when I ate me some beans and rice and took my sugar, I said, oh, shit. When I ate a sweet potato, I said, "Oh shit!" You know, that lady, they wasn't kidding. This stuff is not good for me. And like but serious. And like I said, one of my friends is an emergency room doctor, and he scared the shit out of me by telling me what all the bad things that was going to happen. And he explained to me, and maybe you could do this. He explained to me what happens in your blood. Cause this is how he straightened me out. He explained to me what happens in your blood when you have sugar. What your blood. He said your blood turns to like little icicles or some shit, and he said, and it starts ripping up your vessels. And he said if you don't get it under control, you're going to be getting a new kidney. And I was listening to that. And so when I went to the meeting,
well, I mean, the good news is that he was able to tell it to you the way it meant something.
Right.
And you're absolutely right. The reason you lose your kidneys, the reason you get amputations, is that when you're high glucose, we call it glycosylation. It's already a 3-syllable word. But when red blood cells are glycosylated, you can think of it, here's how I tell some people, if you like iced tea, if you put sugar in iced tea that got ice cubes in it, the sugar goes to the bottom. You can stir and stir and stir, but you won't get it to go into, it won't circulate. And if you drink all that tea, by the time it gets to the bottom, it's just too sweet. Well, the same thing, if you're eating foods that causes the sugar to accumulate in your blood, you're creating something like maple syrup. And when it gets to these narrow vessels in the brain, it's too thick. It can't go through, and that's called blood clots. So if you have real small capillaries in your feet, that's why the toes get amputated. That's why the feet can go cold and you lose a leg. The viscosity of your blood is such that it cannot go through these small capillaries. So if you can give someone an image to help them understand the process, then you're doing your job. So I salute the doctor who could make that plain. The second thing is, if you don't know what a person's eating, in Louisiana, I found out that having corn with another starch is not considered a bad idea. They may have, we have macaroni, cheese, corn, and fried chicken. And I would say, you have corn and macaroni and cheese, those both are starches. And they look at you like, okay, and? So if you're trying to tell someone to have a balanced meal, you have to go further than just using words like balanced meal.
Right.
There has to be some discussion on whose balanced meal. If you live in Louisiana, that might include something that hadn't even crossed your mind. I know people in the area who, if you don't serve some kind of bread when you have a meat, they don't think you finished the meal.
Correct.
You can't have fried catfish and not have some kind of bread, and what they want is a white slice of bread. They'll say, well, what's the bread? Like, we're not making a sandwich. Yeah, but you got catfish. Or if you're serving some kind of a pork, where's the cornbread? So there's that expectation that is cultural. So when you start saying, we send them to a nutrition class, the nutrition has to be cognitive of culture.
That's right.
I mean, I have given classes and told people how to eat ramen noodles, and they said, that's so bad for you. I said, no, it's not. What is bad for you is the packet of flavoring that contains all that stuff.
Correct.
Well, if all you can afford is ramen noodles, let me work with you.
Okay.
I'll get you an alternative seasoning and go ahead and get what you can afford.
Well, Doc, when I went to the nutritionist, she was talking about the stuff that you could eat, and I was going, I don't eat that. She kept talking until I heard her say something that I could eat. She said, you can eat apples. I said, I like apples. She said, okay, you could have apples. You could have, she mentioned you could have beans. I said, okay, I could eat beans. She said, don't eat the rice. I said, okay. And because now I'm fearful of all the things you just mentioned, and I think that should be told to people out front that, this ain't no joke. And then when she said, you got to lose a little weight, and could you lose weight? I said, of course, I used to be an athlete, so I would get up every day and I would walk. And I was nervous because when she said, you have an AC, when I went in there, they said, your AC1 is like 14. And I was like, so what's that? She was like, you're getting insulin. That's what that means. So, and she told me if I got my AC1 down to 6, they would take me off insulin. So I got it down there, and when, took like 6 or 7 months of intense eating apples and And I would take I brought a juicer, and I would juice the apples, take the juice out the apples, and take the stuff, the pulp and stuff, and I put the pulp in the refrigerator, in the freezer, and I would eat it like it was ice cream, and I would use that for my. So I would use that for my sweetness, so I could have myself a dessert, and I'd eat that.
That's a recommendation I just made recently with someone who said their thing was ice cream, that was a reward, that's how they felt positive about things. And I said, there's nothing wrong with eating a frozen dessert, but you choose what to freeze. Correct. I mean, you don't have to go and spend $6.50 for a half gallon of somebody's ice cream that contains a lot of fat and sugar. Be inventive. Right. Create the flavor, create the texture that you like, and continue eating your frozen dessert.
Because Doc.
See, that's why.
I'm sorry. Go ahead, Doc. I'm sorry.
That's why when a lot of folks go for help, the person who is saying they're going to help disregards you as a person. See, my first position is, tell me about yourself. Because if you're asking me for help, I need to know how I can help you. I don't need to come and recreate your life. I'm not going to come in your house and destroy your pantry. When people tell me they eat white bread when they have fried fish, like catfish in Louisiana, I smile. Because that to them is what they do. Now, my job is to figure out how can I help them modify what is their natural tendency and get them in their best health. I'm not there to say, no, you can't do that. Stop this and do it. Because I'm not going to be effective in that community.
Got it.
They may do it for a little while, but eventually we all rebel against change. And the more drastic the change, the more rebellion you get. I mean, I may want to go in and ask one of the ladies, can you show me how you fry that fish? It's delicious. And then I take note. What are they using that we might can modify but not destroy the crispiness and not destroy the taste of it?
Correct.
So a person who's offering help has to be willing to do some work. If the help is something in a bottle or the help is something I can reach in and get off the shelf, I'm probably not trying to help you very hard.
So, hey, Doc, so I found out that if you could get a doctor that you trust and they tell you what is good that you could eat, then you just keep eating that and eat that until you can get your numbers, because you'll be a lot more smarter about what to eat and what not to eat, what to drink and what not to drink, and that way you'll have a chance, particularly if the doctor scares you silly enough so that you know that things ain't a joke. And I think that's probably one of the most important parts, because people think they could cheat, and you can't. You really can't cheat, unless you're a normal person. Now, if you're normal, okay, but you can't cheat, and people don't understand that. They think they could, jack around with the numbers. Oh, my sugar was 200 or something. No, 200. If my sugar is like 130, I want to go to the emergency room. So you gotta think that you have to change your whole thing, and you have to find someone that you really trust. And once they tell you what you could eat, you got to wear that out, because it's your health is at stake, and you might want to hang around for your kids.
Yeah.
Well, I repeat, the unfortunate thing about Western medicine, United States Western, is we have taught people to take a pill. I can't emphasize enough the way in which American medicine is practiced. They are not going for the cure. If you have a headache, in Western medicine, we'll give you something for the headache. If you were doing either traditional medicine or traditional Chinese medicine, or you're doing alternative medicine, the question is, what has made your head hurt? But in the Western medicine, we'll say, try this Tylenol, try this Motrin, try this Naproxen. The question of what makes your head hurt hasn't come up. If it turns out you are working in a computer room and you look at 20 different computer screens, and these computer screens are emitting certain kind of waves of light, your eye strain may be giving you a headache. If I am a person looking after your health, I'm going to ask questions about the contributor to your headache. So that's what I'm saying. People who do the 15-minute visit, who walk in and give you a pill off the shelf, they are not taking care of the problem. They're simply taking care of a symptom. So if we learn that, we come up with this important for me to know my own body. If you know that after you eat a hot dog and a big dill pickle that your ankles swell, you don't need a doctor to tell you that. If you know that you eat a bag of cheese puffs, which is non-food, and your blood pressure rips your head off, you know what caused it. But what is the problem that I see is many patients act like children. They want someone else to fix it.
That's right.
They want someone else to tell them what to do. But if you make a decision, this is my body, I'm going to take care of my body, there is no cheating. Because who are you cheating but yourself?
Now, Doc, in terms of the blood pressure, garlic is said to be a blood regulator, and so...
Well, there's so many factors, brother. Say, you know how I always back you up. Blood pressure is an indicator. If you're driving your car and you look at the gas gauge and you see that line, almost a red line, it doesn't tell you how much gas you have, but you learn what it means that when it's on that red line, that car won't go. So you would say your gas gauge is an indicator. Well, blood pressure is an indicator. If you are overweight or obese and your heart is working really hard to push your 5 liters of blood through all that excess tissue, your pressure will go up. So the increased pressure is saying the force on your heart is too much. And it's like looking at, if you ever been on a hot day and your car overheated, and you see that gauge go over in the red zone, next thing you know, steam is shooting out from under your hood, that gauge is an indicator. If I could get people to understand your blood pressure is an indicator. If your pressure's really low and you stand up and you see stars or you feel like you're going to fall, it's an indicator. It usually means you're not drinking enough water. It may indicate that you're very anemic, but it's just an indicator. So when we treat blood pressures, it is a thing on itself. It really isn't. It's an indicator. So if you say, well, this morning my pressure was normal, and by 1 o'clock it was 200 over 110, then something has changed in your environment that made that pressure respond, because the pressure is what? It's an indicator. So if you're working in an office under a lot of stress, some people say, oh, that boy made me so angry, and I started seeing blinking lights. Then your pressure probably went up because of the anger, the epinephrine that got released, the choline that got released. So when your pressure is not within what we consider healthy, normal range, your first reaction shouldn't go pop a pill, shouldn't be run to the doctor. You need to take an assessment. What happened? What is the indicator that what happened that made my pressure do that? And if we become more aware of self, then we'll be looking at the cure and not just the treatment.
Thank you for that backing up. Listen, Doc. You know, the Negro says, but here's the question. I'm just saying that, right? Now, listen, what happens when the garlic hits the system? What's the chemistry that goes on that will bring the blood pressure at that moment to where it's normal or more normal?
That is such a wonderful question, because let me tell you, sometimes the medicine in controlling your indicator creates a whole nother problem, and people don't even think about it. I can say this with impunity, there is no pill, no medicine that I give you to treat a symptom that is not also creating an additional problem. It's a different problem, but it's still non-natural to your body. Let me give you an example. What treats high blood pressure? If you're a medical student, they tell you give a black man hydrochlorothiazide or HCTZ. Then on your state board test, they will ask you, what is the side effect of HCTZ? And the first answer is gout. So you would ask me, wait a minute, doc, if you know giving someone HCTZ causes gout, they give it anyway? The answer is yes. And when they give you HCTZ to lower your blood pressure, because keep in mind, that's why you're taking it, it is a diuretic, I also know I'm going to be able to sell you 2 more pills. I'm going to give you colchicine and I'm going to give you allopurinol, because those are the treatment for gout. You would ask me, does colchicine and allopurinol have a side effect? Absolutely. What does that do, Dr. Bo? It can adversely affect your kidney. So if I give you colchicine and allopurinol, now I'm going to tell you, don't eat cheese, don't take chocolate, because you can go into renal failure.
That's right.
So do you see what I'm telling you? When you're taking a pill for a treatment, you are also introducing the opportunity for another problem. They came out with diabetic medicine that they were saying, oh, this will revolutionize the control of type 2 diabetics. 2 years later, they came back and said, stop this medicine. It causes pancreatic cancer, and it causes thyroid nodules. What was it supposed to do? It treated diabetes. It kept the sugar in the normal range. What did it also do? It hyperactively stimulated your thyroid, your adrenal glands, and your kidney. So I caution you that when you say, oh, I'm on medicine for that, all you're saying is a symptom that I used to have went away. But you may be unknowingly creating a new problem in your body because the medicine you're taking, Mother Nature did not put it there.
I'm going to have to go, but my question is, are you seeing patients at this time? I know you're doing.
Oh, I have. When I say I'm a concierge physician, what that means is when I am consulting at the different facilities I've talked to you about, I technically will add information or challenge information or get information on the treatment of the patients that are in the advisory governing. But as far as having a clinic and someone comes in and I keep a medical chart on them, I do not.
You do not.
I do specialty medicines. I've done a couple of what I call comprehensive evaluations where someone will come to me and I take them from their mother's womb to where they are now, and I generate usually a portfolio which I give them, and they pay me a fee for that. But no, in the sense of patients coming to me and I have a medical chart and I put them in the hospital, I write scripts, I do not. Not anymore. I got my medical degree in 1989. That's 30 years ago. So I've been doing it a long time, and I've decided to be more administrative, although I love diagnosis, and that's why I stay active with the various boards.
Do you supervise anyone who's in practice?
Up to about 3 years ago, I had a program. I really like my certified medical assistants, those who know they're an alternative to nursing, and they learn to do front office, which is billing, and they learn to do clinical, which is giving shots, and they also can do laboratory. So they're one of the most versatile healthcare trained persons available in America. And I worked with Dillard and other facilities to certify, because after they finish classroom, like a nurse, they have to do clinical. And when I was running clinics in Louisiana, I would take on 3, sometimes 4 of them, and they have to get signed off on giving so many shots to babies, giving so many, taking blood from so many different people. So I was their sign-off person. That's just called a clinical supervisor. So I have trained nurses, medical students, CMAs, and yeah, I love it. But I don't do anything where I'm obligated to report on time to any facility.
I hear. I have to come up with another question. I'm hoping I
In
can.
other words, I don't work for anybody but myself.
Right. And I thank you for taking my 1 or 2 calls in the past.
Yes, indeed.
And I really want to call you again. I respect your time. I respect,
Yes, indeed. Oh, I love teaching, and when I see that light bulb going on in a young healthcare, and part of afterwards, when I finished my presentation yesterday, they kept me another 2 hours, and the reason I was so happy to do it, in the audience, I had, a ninth grader, I had several high schoolers, one recent graduate that was still under the age of 20, and whenever I have young people in my audience, and they have questions, my energy surges. So I had a delightful after conversation with parents and young people concerning all kind of health issues. And my ninth grader had the insight to say, because we talk about BMI, we talk about obesity, diabetes, and so forth. She said, the actuary that you showed, because I showed them how to calculate BMI, she said, is that based on black people? I said, absolutely not. That's very astute of you.
That's right.
That this is how your insurance, oh, by the way, if you didn't know, insurance companies use a calculation of your weight to determine how much your policy costs. So if you're applying for life insurance and you're overweight, you will pay more than the person who they consider within normal range. And they do have a table where you can calculate what they consider normal range for your height and age. And I showed that in my presentation, and this ninth grader picked up on that. She said, so that means that black people who have more curves in their body will be charged more for life insurance because this is not based on them. I said, sweetie, you have just graduated. You should be given a certificate, because there are people who don't understand what you just saw in this one presentation.
That's right. Okay. Well, I hope to call you soon. But I know
Okay.
I know you need a rest after this weekend, so it'll probably be Monday.
Dr. Bowles, I'm going back to garlic. You use the question to explain us an aspect that otherwise would have been missed. But what's the chemical reaction within the body that would bring the blood?
Okay, well, now when you're talking about garlic, is that what you want to talk about?
Garlic.
You want to talk, I missed it.
Garlic.
Huh?
Garlic.
Okay, the reason garlic has any effect is the same reason that onions would have an effect. It's the same reason that beet juice has an effect. If you know about someone having a heart attack, what is the first thing they tell you to do? Nitroglycerin. They tell you to put this little pill under your tongue, or if you're in an ER setting, I might spray nitroglycerin in your mouth. But what I'm doing is I'm introducing a load of nitrogen into your body quickly. Well, garlic has a natural nitrile compound. Onion has a natural nitrile compound. Beet, the same thing. So Mother Nature is the first one that had the right fix. What the medicine people did is simply found out what component in a beet, what component in garlic, what component in onion gives this release, and they isolate it and called it a name, nitroglycerin. So when you're taking garlic, whether it's a raw garlic or it's in the garlic, they have now a peel that doesn't have the smell that you can buy it. It is simply stimulating the body to release nitrogen oxide. Nitrogen oxide causes a blood vessel to stretch. It dilates it. Therefore, when you're having a high pressure, if you know anything about physics, if you have a narrow opening and a large force, then pressure will rise. But if that narrow opening can be expanded, that pressure will drop. So when I'm eating something that it has a nitrogen oxide causing effect, the vessels will dilate, and that is a natural way to decrease pressure.
Okay.
So you don't have to do nitrogen. You don't have to do garlic. You can do garlic. You can do onions. You can do beet juice. There's a bevy of nitrogen-stimulating foods that's natural to our agriculture system. We just don't teach that in children. When you're in school, you don't learn it.
There is said to be a video of Will Smith, the actor, and he is said to have taken he's in this video which says, "I've been told." He's in this video where he's testifying, he's giving a explanation that he was on a 10-day fast, and that after 4 days, he did not have to use his high blood pressure medicine. And even though you haven't seen the video, I haven't seen the video, what could cause that to be a factor, if it's true?
Last night, what I was teaching, and I love it when it comes full circle. When you are fasting, you are metabolically switching from the use of glucose as a fuel in your body to the use of fatty acids and triglycerides. Now, all that sounds like gobbledygook in its biochemistry. Let me take it back another way. When you have regular food and you eat, let's just say, an egg sandwich for breakfast, the bread will become glucose. The egg is protein. When the glucose turns on, or when you digest it, your stomach has digested and your bowels absorbing it, it triggers your blood to do something. The blood taking the glucose through the pancreas, I think one of your panelists mentioned pancreas, and it tells the pancreas, release insulin, release digestive enzymes. So it's like the circulation of the blood signals other organs. They give them their marching orders. When you are fasting and drinking only water, the same blood circulating around the pancreas says, do not release insulin. Do not release digestive enzymes. It tells your pancreas, do not release cortisol. Do not release mineral cortisol. So whether you're eating or not is another way of what orders are you giving your body. So think about marching orders. So if you fast for 4 days, you have told your body consistently, don't release a whole bunch of hormones, maybe up to 20 things that normally every day when we're eating these junk food and garbage is being dumped in our system. Now you've told the body, don't do it. So in that period of time, whatever organ needed to recover, let's say your liver has been trying to get rid of that orange color that was in your, Frosty that you had at Dairy Queen. Maybe your liver been fighting to get rid of whatever additives was in that cheese puff that you ate. In those 4 days, your liver can recover. It can finish getting those toxins out and suddenly start to function the way it was normally meant to. Because when you're eating junk, guess what? You are distracting the liver from its normal function. When you're eating too much cheese and you're eating too much chocolate, you're making the kidney fight off those toxins and not do its normal function. So why is fasting something that is curative? It stops dumping all of the enzymes, is trying to pick up sugar, trying to pick up starch, trying to pick up protein. Those they're called off. Go to bed, go sleep. Your liver now can say, whew, I'm so happy I don't have to fight off keto cheese and I don't have to fight off all this artificial EDTA, and the liver suddenly heals itself. And you start to say, wow, my blood pressure is normal. That's because the liver does its job, the kidney does its job, and you are no longer fighting off the enemies that you are letting inside. So that's why fasting alone can have a curative effect.
All right.
And look at Mother Nature. If you've ever been sick, the first thing you do is you lose your appetite. Think about it. Mother Nature stops you from eating.
Very good. Now listen, we're going to conclude this portion so we can get into the education piece on the mammogram and thermogram. And in terms of the thermogram, I learned about that in an interview with someone in the natural healing. Could have been a doctor, could have been a midwife, whatever. But the point is that they were pointing to thermogram as preferred over a mammogram. The mammogram, if in fact there is, this is what they were saying, if there is something there, the mammogram can squash it and really create a problem. So that could be folklore, that could be whatever.
Now, I can comment on that. When they sandwich the breast, depending on the sensitivity of the person, if they're set on seeing and they don't care how much pain you're in, now no two women will act the same way. The pressure they put on a lady with the same cup size as mine, she may be more tolerant. But if I start saying, oh, and they look at me and say, well, there's only this or that, that person is not sensitive. So mammograms sometimes can be the user sensitive. They can create a problem. They can be bad at reading. A thermogram is less invasive. The theory behind thermogram is if you have something growing rapidly, like a tumor, it will show up hotter. A thermogram of a rapidly growing something will glow white. We have used it on children that we don't want to x-ray. If you do a thermogram on their joints, you'll see that that's where they're growing, and it'll glow. Where you go to an 80-year-old, it won't have the glow because there's no active growth. So they use that thinking to say, if we do a thermogram of any kind of density, I don't care how heavy your breast, we can see if there's something disproportionately growing in that tissue. And yes, that is an efficient way to evaluate rapidly growing. Now, the only problem there, Brother Leroy, all tumors in the breast are not rapidly growing. Some of them grow very slowly.
In terms of the biopsy that is taken when in a previous interview regarding men and the prostate, it was explained that the biopsy would be more than just one hit. They would do multiple hits. What is the situation with?
Well, in a breast biopsy, by standard of care, you need to take a minimum of 6 points. And the reason they give a minimum, notice that minimum, some may do 12 or 15. When you are sticking a needle into what you might say is a mass or a cyst, I tell people to think about that as a snapshot. If I walked in a room and took one picture and then walked out, how reliable can I be looking at that one picture and I tell you what's going on in that room? You probably say not very reliable. But if I walked in and I took 12 pictures turning myself in different positions and then looked at those 12 pictures, I would be better able to tell you what's going on in that room than if I only took one. Well, that's what biopsies are. I'm putting a needle or trocar or some kind of inject, and I'm taking some tissue. I could be right next to the cancer and miss a piece. That I went in just right beside it, but I didn't get in it. And if I look at what I took and say, oh, this is healthy tissue, then I may give you a false report because I didn't sample enough.
So
we're getting a biopsy, unless they're doing a cyst. Now, if it's a cyst is like a balloon full of water. And if I put a needle or trocar in a cyst, I can draw fluid. And the fluid, how much fluid I get would determine how accurate I can be in diagnosing what caused that cyst.
So the protocol for biopsy is the same with males as it is with females. Multiple.
That's right. If I do, even if I did a skin biopsy, if I were checking you for melanoma, the most that we do, if it's on the top of the skin, we take the entire lesion and then chop it up and look at it. But if I say I'm going to be doing a colonoscopy and I see a polyp, I will take the whole polyp, but I'm also going to take biopsy in the surrounding tissue. If you think about it, when people get a breast biopsy, in the olden days, I'll give it 30 years ago, sometimes women would have a disfigured arm. The reason that they would get back the heavy arm is once they got the breast lump, they would take lymph nodes. So the lymph nodes is also part of the biopsy. And in those times, unfortunately, they would take the entire lymph node family. And when the lymph nodes are completely removed from the armpit, that's when the women would get these oversized, misshapen arms because they did not have the lymph flow that they once did. They would derange the natural lymphatic flow. So whenever they take a biopsy, they take more than one piece.
And the very last question in this medical segment relates to elder or geriatric care. And when you have someone who might be considered a person suffering from dementia, are there actual medications that can present that kind of situation, over a course of time?
Absolutely. My first point is before you accept the diagnosis of dementia, I don't care if they're in a nursing home or if they're in a family setting, you want to have a full evaluation of that patient. If you just know he's getting more forgetful or he didn't put his pants on this morning and therefore he's dementia, let's give him some pills. You need to make sure that they're not suffering from thyroid. Hypothyroidism can create appearance of dementia. Make sure that they do not have a vitamin D deficiency. Certain nutritional deficiencies can give a dementia-like behavior. So before we're too quick to give them some kind of medication that can help their mental faculty, make sure there's not a systemic problem giving rise to the mental problem.
Okay, Doc, are you ready to go into the classroom of the elementary high school? If you are.
Yeah.
Okay. Ladies and gentlemen, now we're shifting into the area of education, and we've asked Dr. Bowles to respond to a topic of how a parent or grandparent can prepare their child to be an A student. Dr. Bowles.
Oh, that's a delightful question for me, and believe it or not, I had that question last night as well. My first and the most strongly advice is if you are concerned that you want to create in a child a love for learning and consequently they can rate very high on testing and evaluation, you want to allocate specific time to the child. And most people say, I'm literally saying that if I have little Susie here and I'm coming over to visit, I want to make an announcement. I would tell parents and whomever else, little Susie and I for the next 15 minutes are going to do X. And you say, well, that doesn't seem like a big deal. It certainly does. You create in that child an expectation of focused activity. And I don't care what that activity is, and if you are targeting little Susie, you don't play with little Billy too. Don't tell her to share. You focus on little Susie. And if little Susie wants to do dolls, you do dolls. If you want to teach them something specifically, one lady wanted to teach her granddaughter a prayer for nighttime. Every time she had a chance, she would allocate her 15 minutes, and nobody could interrupt. To the point that little Susie at the time was 2 years old would say, "Not now, Mommy, we're doing this." And you say, "Oh, that's interesting." No. Time management and attention are the primary features of anyone who excels. So start young and be dedicated. And don't come in with that silly talk, mommy, nanny, tatty. Speak words. Whatever the language is, make sure that you are clear and that if the child has a speech impediment or their ability to respond, give them the words. Would you like for us now to practice the prayer? Are you ready? Let's get started. So always make sure that you are articulating whatever the lesson is that you want learned. And it can be as little as I said, 10 minutes at a time. But if you teach a child young that when I'm about to learn something, it should be done in an organized fashion, and it's my time. I'm important. I'm important to grandmother right now. I'm important to mommy right now. And you will find such children, when they're put into an academic setting, whether it's kindergarten or school, when they're ready to do something, they understand how to focus. So if you got to lose time saying, come back and sit down, Johnny. Wait a minute, Johnny, pay attention. You are not teaching. You're now trying to impose social dynamics, and that is distracting from learning. That's my number one. Give them time. Make sure they understand that you have packaged the time. This is organized time for X. If your child has lots of energy, you may say 10 minutes is a long time, then make it 5. But make sure they understand that when we're ready to do something, we focus and it's important. And that's how you start. My second advice is never lose an opportunity to teach. If you're going to get in a car and your child's in a car seat or back seat or wherever, not in the front, you turn to them and give them the ability to strategize. You say, Mommy is ready to go to work. What does she have to do first to make the car go? Now, this is a 2-year-old, a 3-year-old, and they may have some fantastic answer, doesn't make sense. You hear it all the way to the end and say, no, Mommy has to put the key in this ignition and turn it. That's how we crank the car. And if you do this process every time that you get in the car, what you have done is you're teaching this child effect, that cause and effect. I put the key in, I turn it, the car will go. Or if you go to the gas station, and I know you're in a hurry before you jump out and pump the gas, you say, what does Mommy have to do to make sure that our car can get to your school, can get home? So she needs to put gas. If you have an electric car, explain the electric car. If you do this, what you have done is given a child a pattern of understanding.
Doc, your voice just trailed off.
Well, I'm saying you can do it however rich you are, however poor you are. Children who grow up to be chefs, you're going to report that grandmother explained cooking, or grandmother let them crack an egg, or grandmother showed them something. So the sooner you show the child that learning is important, and the more efficient you are at explaining cause and effect, will be the brighter child you'll have. You'll see them at 4 or 5 years old. A glass will break, and they might say, Mommy, we need to get a broom and sweep it up, or Mommy, we need to be careful. You will see them anticipating the solution. And then you know you have a child capable of excelling on whatever they choose to do. If you have a child, everything is, I don't know. I've talked to some children don't know their parents' real names, don't know their address. You would say, are you hungry? What do you want to eat? Oh, no. If you are indulging that, then you can't expect this child to excel in school.
So how do you flip that one around?
Well, you don't let it get started. 2 or 3 years old, you say, okay, we're going to have lunch. Are you hungry? If the child's not sure, you say, well, if you're not hungry, we'll wait. When you're hungry, let me know. Well, see, the thing that's happening there is you put a decision to the child. If you just say, okay, it's 12 o'clock, time to eat, come in, sit down and eat, then you've taken every bit of the responsibility. And there are some of us, genetically or otherwise, that if you'll do all the work, I'll let you. So if you're trying to inspire in a child a desire to learn, a problem-solving mentality, stop doing everything for them. I've seen mamas dressing children, putting the shoes on, tying them up, and okay, let's go. And I'm saying, how old is that child? Oh, he's 5. Why are you still putting your shoes on him and tying them up? You are mentally crippling that child. He's old enough to put his shoes on. If you put them on the wrong feet, that's a learning opportunity. They'll say, well, I didn't have time for that. Okay, then you're saying you do not want to give your child a chance to excel on his own because you don't have time.
Doc.
So if a child is always saying,
Doc, how do you know in the present that particular non-involvement in cleaning their room or making up their bed or tying their shoes affects the adult or the older child? How do you know that?
They will demonstrate it in a classroom. Let me just give you an easy example. 3rd grade, teachers trying to introduce math, and a lot of the kids are talking among themselves, or someone drops a notebook off their desk on the floor and spends an inordinate amount of time reaching to pick it up. that teacher looking across her classroom can see I don't have attention. They're not looking at me. They're not eager to know what it is I have to tell them. She doesn't need to, that in itself distracted. How are you going to teach math when you don't have the attention of your student?
Right.
So if I'm in the observing, and I do go and observe schools, my comment to the teacher's aide or to the principal is before you start teaching this course, you need to have some routine to ensure the children are focused on what you're about to do. Because obviously in their home life, they've not understood what focus means, or they've not been taught when you're about to do an organized activity, you stop everything else. And that's why I'm saying, parents, you need to teach that.
Okay.
And you do it not by going through some kind of rote behavior. And that's why I'm saying, if you're addressing your kid and that child's older than 4 years old, you're depriving them. If you haven't discussed some of the basic activities, why do I sweep the floor? Why am I washing the dishes? Or better yet, I hope you are sweeping the floor and you're washing the dishes. This is opportunity to teach, and you don't have to have a degree.
Mm.
And if I come in a room and a child comes and says, what are you doing? Or how is it doing? Or if I'm watching them do something, there are a lot of people, particularly when they're impatient or tired, so I'm not going to be cruel and say it's because you don't want to teach. You've worked the 16 hours or 12 hours, you're tired, and the tendency to instruct is another job. You came off of a job, and now you got another one. It is easy to say to the child, be quiet, sit down, turn on TV and put SpongeBob on. But when you do it, know what you're doing. Don't just say, well, I was too tired to A, B, and C. What you should really say is, I was too tired to A, B, and C, and I have stunted the mental growth of my child.
Got it. Okay, continue.
Well, I'm just saying, that's how I know. And the children that oftentimes, unfortunately, in culturally insensitive classes, now let me break it down, I said it politically correct, now I'm going to speak very frankly. Young black boys who have a white teacher, female, are at a distinct disadvantage for learning organizational skills and good focus. You say, wow, that sounds like that's a big insinuation. I have volunteered at various schools here in Alexandria that are considered neighborhood schools. And what that means is that the children will be black if it's a black neighborhood. And what it translates in Louisiana, they have white teachers and white principals in black neighborhoods. Now, during segregation days, we had black teachers and black principals in black schools. Consequently, if Johnny acted out, it's very likely that the principal knows his father, or the coach knows his father, or even more so, the teacher knows his mama. So when we had to correct Johnny, he wasn't just being corrected theoretically. He was being corrected on every possible level, because a lot of times preachers were also teachers, or they were assistant teachers, or they were substitute teachers. So what we've done in our integration, we've created a cultural if a young black male exerting his natural tendency to get up and wander around, I see nothing wrong with that. But if I have a white teacher who's afraid of black men, and this young man is of any size, considered Shaq O'Neal when he was 12, he was 6 feet tall, he might feel threatened. So she's going to be more alarmed and agitated at the free movement of this young man than I would. Because he looks like my brother, he looks like my cousin, he looks like my dad. I may stand up, walk over to him for a few minutes and say, come on, son, let's go sit down. I'm not threatened. But this person who's not culturally sensitive is threatened. And this young man starts to get labeled. He is disruptive in my class. He's disobedient. When I tell him to sit down, he talks back. So if you and I, who know the culture, look at that, that child has done nothing wrong. However, he is labeled in second grade as a disruptor, and he most likely will be recommended for ADHD and start on medicine. So we've lost control over our cultural acceptances because the people who are looking at it don't have the perspective that we have.
Okay, got it. Okay, continue.
So if you're trying to get an A student and they're going to be in an LSX society here in America, there's a level of conformity that's necessary. And how do you train Annie not to stand up and walk around in class? You start what I describe at an early age, get some kind of organized, attentive process. Johnny likes. It can be you spend 10 minutes with him on a game, or you can spend 10 minutes with him on the tennis court. Doesn't matter. The point of the exercise is time to learn is precious time. You also are teaching amount of time you spend on learning should be quantified. That if you tell a child to do their homework, that's a foolish thing to do. You should say, let's work on your homework for 30 minutes, and we can take a 10-minute break. And then we're going to come back and work on your homework another 30 minutes. Time management, by definition, needs boundaries. When does it start? When does it stop? Because if you know that, okay, look at the clock, in 5 more minutes I'm going to do this, you're more apt to finish than if you have no end point in mind. So start early. That's my big one. Make it something private. Little brother, little sister should not invade. Grandma, you can do it. Maybe you want to teach them a prayer. Maybe you want to read a part of the Bible. Maybe you want to sing a song. The activity is not as important as the time specificity, the appreciation that you and me alone are doing this. You can take a walk, go to the park, whatever it is. I don't assign you a duty, but you need to carve it out. Johnny and I are doing X for 15 minutes, and then make it something special. When you're doing a routine, mundane task, make sure that a child under the age of 6 gets full understanding. Mommy locks the door, the key goes in here, and this is how we lock the door. Mommy's putting on the security, these buttons give me the numbers, and I put on the security. By the time a child is 6 years old, he or she should have a clear understanding of day-to-day process. If I say to Johnny, how do you make coffee? That's the pot right there. Mommy puts water in it, or Mommy puts... That's how you want your child to be able to respond. So if it's, I don't know, then you've missed the boat. That child is not socially ready for the conformity of school in America.
Talk about hands-on learning.
Well, what I like, because I'm a scientist, I like giving children challenges. The simple things like vinegar and bicarbonate of soda makes a foam. Most children find that fascinating. Using food coloring to change the color of icing when you're putting it on a muffin or a cookie. Children find that fascinating. So you look for ways to wake up an idea in a child. I can remember I would take my younger brothers out, and one of the things that was thrilling to me, that if there was a board on the ground and you moved it and you dug in the dirt a little bit, you find worms or you find bugs. There's life in there. So just these little discoveries, which many of us would say, that's no big deal. To a child would eat it. I mean, if you're out cutting the grass or you're doing gardening or weeding, invite the child to see if you pull up this plant, it's got this on the bottom, it's called a root. If you're doing urban gardening, make sure the child can see what happens when you're harvesting your carrots or harvesting something. If you see a caterpillar, make sure they see that worm and talk about it. The opportunity to teach should be just everywhere. If you don't have those kind of props, buy some bubble. You know, children used to blow bubbles. You have that, I think, a Dollar Tree or Dollar Store. Even in the most concrete, urbanized food desert, you can buy different little props that can intrigue a child and stimulate thought. If you have a big parking lot or asphalt and children have nothing to do, go get some chalk. And I hope everybody knows what chalk is. It doesn't cost much. You can get it at Dollar Tree or Dollar Store and draw on the sidewalk. Do a hopscotch draw. Let a child draw something. And then you get the hose and wash it off. If you're in a neighborhood, if you're in a parking lot of a closed building or somewhere where there's not a lot of traffic, you can leave it and come back to it. But you need to always engage a child in imagination. We've gotten to the point where where imagination among children is no longer utilized, and that's a mistake.
Dr. Bose, I just want to give
Yes.
you, you just said something that really struck me because I inadvertently did this with my granddaughter. She was complaining, when she was in that age group about math and not wanting to do it and all that, and I actually used your technique quite by accident, I see. And I started telling her that, okay, we're only going to work on the math for like 7 minutes, and then we're going to take a break. And she said, how long is 7 minutes? And I would show her when that hand gets to so-and-so. And then all of a sudden, when I did it like that, she started not acting like, oh, I can't do it and all that. She started going, oh, I only got to do it for 7 minutes. You only got to do it for 7 minutes. You only got to do it for 7 minutes. We're going to take a break.
Absolutely.
And it worked.
I mean,
perfectly.
You find what can focus them. See, what you just said is it's not so much the math. I mean, it's important to get math, but you trigger the brain to focus. You told them the time. And that's why with most children, however rebellious or short attention span, if I say to you at 2:30, we're going to do X for this amount of time.
Correct.
Now you have an anticipation, and you know the beginning and the end. Sometimes what children fear most is the mystery. How long do I have to do that?
Right.
How come I have to do that? But if you've already given them the answers before you start the test, now you have them focused.
Right, and Doc, when she would, I would go back to her, I said, okay, time's up, and then I would say, you need another minute or two? And she'd go, okay, all right, take 2 more minutes, and then we'll do it. And, once she knew that, because, I always thought I was just negotiating with her, but I guess what you're saying is that negotiating with them is all another learning experience on how to manage your time.
Equally important, what I think that we don't realize is when you give a young person some say in the matter, you are giving them power. And everybody likes to feel like they have some power. We don't ever want a child to be in control. I'm not advocating that. I hate a household run by children. But when you empower someone, they feel important. The title of my talk last night, it was self-empowerment. Anytime you make a person feel appreciated, you're really empowering them. If I walk in and I say, you did a wonderful job telling that young man he had 7 minutes to do the math, and I appreciate that. Well, now that inspires you to do it more or do it again.
And I did, and it worked, and I got her to not be afraid of doing the math, looking at things as a little task, and just go ahead on and knock it on out, and then go to your YouTube or whatever little crazy stuff that you like to do. Go ahead and do that, but let's spend this little bit of time getting this out the way so that we ain't got to listen to your mother complaining or
that's outstanding. I mean, kudos. That's to be congratulated. Another thing that can work, especially when we say the tweens, and that's really age 9 to 12. They're not teenagers, but they're testing. Tweens can sometimes be motivated when they are allowed to have some instructional authority. If you sit down and say, okay, when do you prefer to do your homework? Is it before dinner or after?
Correct.
Or something like that, where they feel like they help set the schedule.
Correct. Like what you want to do? You want to eat dinner first, or do the homework, or you're going to watch TV for a half an hour? What are you going to do? So she would come to my house. I would go,
exactly.
Okay, you're going to watch TV for an hour, or you're going to take a nap. Or you're going to take a nap for how long? I'm taking okay, I'm going to wake you up and annoy you in 1 hour. And then you're going to go do so-and-so. And I would wait for that hour, and then I would annoy the crap out of her until she got up because we agreed on it. And so that's what we have to do.
And also, the things you're saying, I'm saying, but you're doing something else psychological that I want to comment on. When you teach someone boundaries and you teach them organization, if you look at military, that's all they're doing. It's not like they're mean. They shave everybody's head. Everybody gets up at 6 o'clock. You run 5 miles. The reason they're doing regiments, and this is why I think our young society is going to pot. We stopped having boundaries. And when we sit and watch these television programs with reality shows, you go to the bathroom with somebody, you're in their bedroom, you hear their thoughts. You are telling a young group of people you can invade everything, you can do it when you want. When you don't have a bedtime, you can decide when you sleep. When you don't have a dinner, organized dinner or eating schedule, you can eat on the bus, you can eat on the coast, you can eat on the street. So we have abandoned what is really society. In order to have an ordered society, you have to have understood boundaries. We say you drive on the right side of the road. If you call in the news, somebody from America killed someone because she was driving on the wrong side of the road in Britain. And then she ran home talking about, I got diplomatic immunity. When you're in society, you have to have the boundaries. And if you want to have a healthy home and you want to have a child that excels in this society, you, at the earliest possible, introduce those boundaries that will allow that child to excel. And that's all you're doing. Developing rituals, you're creating expectations, you are empowering that person to do their best. And that's how you do it. What you're describing is magical, and I think the big question that no one's really looking at is when you have no boundaries, then the child has no limits, and their ability to focus, their ability to take time management seriously, their ability to organize their thoughts, they're just not there.
And you're not going to have any creativity without any boundaries. There's no need to be creative if there's no boundaries.
I mean, I was working as a tutor for a fifth grader, black female, and I said, okay, write a paragraph for me. And I gave her a composition book. She had no, respect for the lines on the paper. She wrote any kind of way on lined paper. And I'm looking at her and saying, why do you think the lines are on that paper? And she says, oh, I write these. And I'm saying, okay, if you're controlling your hand, let's try writing smaller. But she had total disregard for the lines on the paper.
No boundaries.
I mean, I didn't know. That shocked me, but that showed me that her ability for conforming, and believe me, secondary school or primary elementary school is so much about conforming in America. And I put it that way because if you go to other countries, a lot of teaching is done hands-on. They'll take a trip to the woods or they'll take a trip to the mountains. When I was at Yellowstone in Wyoming several years ago, there were so many Japanese children there. I was shocked. It's like, this is American National Park. They allow the children to see, have hands-on, have experience. That usually means you got money. So if you don't have money and you want your child to do well and they can't do what we call first-hand experience, then we have to prepare them to be capable of focusing and absorbing when they do have the chance to learn. Now that makes me come to another phase. I started at 2 to 3 year old, which I would call pre-kindergarten. What I love to do, and my local library, Martin Luther King Library here in Alexandria, has adopted showing movies to children on Friday and Saturday nights. Now, they're not doing box office movies. They may have a few, but they show travel movies. I'm sure you've seen on public TV the different people who travel to Spain or to Italy or go to some of the major 7 wonders of the world, and they make a little video out of it, like a 30-minute video, let's go to the Sistine Chapel. Well, they do that at this library, and children love it. You know, if you can't afford to travel, and you can sit there and go with, what's his name? Last name is Steve's. He has 2 first names for a name, and he's walking you through and pointing out this is Sistine Chapel, or I'm in Vienna. Then you are essentially widening the cultural exposure for these children that may be locked in this small town in Louisiana. But if you're consistent, you will be developing a cosmopolitan level of thinking in these young people. So I'm just excited that they started that series, and my understanding is ages of about 6 to 12, and the whole point is take you around the world. So those are things that can be done that doesn't cost anything.
So what you're doing is combining, you're not only using every opportunity to teach, you're using every tool that is available to teach. And I'm talking about...
Absolutely.
Yeah. Those things that are free to the public to do, that would be a visit to a farm. You're down in Louisiana. A visit to a farm, a visit to the museums, etc. Those are things that...
Well, I'm going to surprise you. I even have taken some inner city, culturally deprived children to an outfitter. Now you say, what are you talking about? Here, I guess it's about 90 miles from Alexandria, Bass Picnic Shop and Cabela's are big outfitters. You know, Louisiana likes to fish and whatever. Now, in the outfitter shop, now they sell fishing rods and they sell boats. But in these outfitter shops, and I suspect it's probably true in the Northeast as well, is they have a lot of taxidermic things on display. And I have more than once taken a group of kids, because some urban children are afraid of dogs, they're afraid of cats, they squeal if a bird flies near them. I don't know if parents teach that or what, but they seem hyper spooky. And I have taken family by family, never in a big group, take a trip, and my one trip is to a place called Cabela's here in Louisiana, and they have certain scenes, like they have stuffed deer, they have some alligator stuff, and they have set up a bayou scene, and these children can walk right to these stuffed animals, get a closer look. Sometimes there's a automatic speaker that will start talking, but what it does, it lets that child get over these unfounded fears without having any risk. So petting zoos are great if you have the right people there to monitor, but this is even, in my opinion, a little safer in that if they want to go there 3 or 4 times, if they want to get as close as they can, until one young man who, it was embarrassingly sad how frightened he was of grasshoppers and ants and whatever moved, that before we left the tour, he asked me to go back to hear the talking man. And that was because they had like a hunter kneeling on one knee, and he was explaining and pointing to different animals that was in this setup or staged environment. So every opportunity, I've even taken young people into a library that had a lot of busks, like the president's heads were displayed. Why did I do that? They didn't know anything about busks or art. Right. And before I took them to an art museum where they could get in trouble, I took them to somewhere they could get close to it and understand what I meant when I said this is a sculpture, or what I meant when I said this was a busk. So when we went to a more organized setting, it was no problem at all. But sometimes we have to take baby steps, I guess is what I'm saying. Right. That when I see a child and they say, oh, he's a 4.0 average, I say, let me meet the parent, because I know they work too.
So our next session on preparing your child to be an A student will be, okay, you missed the opportunity from age XYZ up to 10. Now what do we do with the teenagers, or the tweens as they're called? That would be our next session.
Okay, sounds exciting.
You said no big thing, right?
No, I love that age. No, give me my tweens. I told you last night I spent 2 hours, an hour and a half away from my house talking to these adolescents because they were interested. That's my energy. I told them, any information I give you that you take away makes me live longer, because my reach is as long as yours.
You hit on it, but very quickly, how parents are tricked into putting their child on Ritalin, and the child is really bright.
The sad thing, brother, is it's more than just tricked. They are extortions. I have had principals, when I was in the medical director in South Carolina, I had a principal of a junior high school call me and say, here is the list of students you need to put on Ritalin or Adderall, and she began to read the names off. Now, this is a phone call, never met her. And I said, when did you start practicing medicine? She said, you can be cute if you want to, but the parents are going to lose their job, because when these children get in trouble, I have to call them, and they have to get off work and come and get them. Now, her intent was extortion of me. Here I was a physician. I guess I was supposed to write the names down and start writing prescriptions. I'd never met the child. I didn't know, but she was telling me to save the parent's job. I needed to write these prescriptions for these children. Now, that's not just fooling a parent. That's full-line extortion. So I have empathy with a parent who has to leave work and pick up Johnny, or have to go get somebody, and you may be getting a cut in pay or losing your job, and what they will see as a quick fix is put Johnny on Ritalin.
And this is the last question on that. The long-term effect of Ritalin and Adderall. I'm talking in terms of there being
okay,
gateway.
I'll give you a quick answer. Methamphetamine is a handcuff. It is a mental handcuff. If people who go to big doses, 10 milligrams, more than 10 milligrams a day, and I know some children on 10 milligrams 3 times a day, what you are doing is shutting down the dopaminergic system of the brain, and this child is under medical handcuffs. He cannot think freely.
And he or she becomes the problem.
He's a zombie. He can't learn. You can't teach a child who is drugged on Ritalin. They talk, he's much more mental in classroom, but he can't remember. You just put his brain on handcuffs. Many children go to sleep. Oftentimes they don't eat. You'll see a child losing weight. It is a major mind-altering drug.
Dr. Velva Bowles bowled us over today, and we want to thank you and thank your parents and your grandma for setting you on the path where you not only learn what you do know, but you share what you know. God bless you, my sister.
Yes, indeed. Thank you.
And ladies and gentlemen, this has been The Communicators, October 20th, 2019. Our guest being Dr. Velva Bowles, covering mammograms, thermograms, examination of the breast, and also how to prepare your child to be an A student. We invite you to investigate everything that she has said, because in this program, we tell you don't believe anything, but if you sit and listen to it or view it, then you're obligated to do investigation on your own. Don't be a sit-down artist. Get on the computer and start searching for information that compares to what she shared with us, or maybe it's contrary, and if it is, then let us know. God bless you.
Bye-bye now.
He was grooving, and that was when he could have sworn the room was moving. But that was only in his mind. He was sailing. He never really seemed to notice vision failing, 'cause that was all part of the high. The sweat was pouring. He couldn't take it. The room was exploding. He might not make it. Please, children, would you listen? just ain't where it's at. You won't remember what you're missing, but down some dead end streets there ain't no turning back. They were standing, everybody in a circle, the whole family, listening to the preacher's words. Sis was crying. She alone held a secret about his dying. Tears falling to earth, and maybe her fault. He was so trusting, God only knew why. They were dusting. He's gonna be the death of you children. It just ain't where it's at.